Hi everyone. Good morning, good afternoon, good evening, wherever you are. My name is Adrianna and I'm a colleague of your professor's, Vicki Klein. And she asked me and I somehow agreed to record a brief video about my background in macro social work, answering a specific set of questions. This is, I think, take 12. They've all ended in oops, that's not what I meant to say, and then blah, 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 and then me reaching for the button on my iPad and starting over. But this time I'm just going to keep going. So thanks for bearing with me. I've got 4 questions. Question 1 is, who are you, where do you live, and what do you do? My name is Adrianna. I'm originally from Tucson, Arizona, which is about an hour north of the border with Mexico. I currently live in Baltimore, Maryland, and I am a senior project manager for Johns Hopkins Medicine in a department called Healthcare Transformation and Strategic Planning. And what do I do? I have a wonderful job overseeing a charity program that's offered to uninsured, underinsured, and uninsurable patients who come to Johns Hopkins Hospital and one of our affiliates, Johns Hopkins Bayview Medical Center, who need access to primary and specialty care. I also get to be a part of a dozen different projects under the umbrella of community engagement. Number 2, what kind of work advocacy am I engaged in? So advocacy I like to think of as having 2 different parts. There's internal advocacy and then there's external advocacy or community engagement, whatever you want to call it. Internally, advocacy for me involves education and training to our internal staff and partners across both hospitals who in some way carry forth our program by delivering care to patients enrolled in charity. And by the way, the program is called TAP. You can Google it, the Access Partnership, Johns Hopkins Medicine. You can read more about it. This is a mission-driven program that provides access to care to patients who would otherwise go without care in many cases. It is part of the health system's community benefit work, which is a lot of jargon for all nonprofit hospitals in the United States have an IRS obligation to demonstrate their commitment to being a nonprofit by way of charity care programs for patients who are uninsured and by way of a whole host of other activities and investments. And so there's internal advocacy of education and training. Sometimes this is around a specific patient case. Sometimes it's about workflow and operations and procedures. Sometimes it's instituting a new policy that makes sense given a current problem or the current environment or healthcare reform and so on. These can be very micro advocacy issues or the giant system level macro pieces that impact our daily work in healthcare. And so there's I think I answered number 2, which I didn't read the question, or maybe I did. Blah, blah, blah. There you go. I'm going to keep going. Question number 3 is, why does being a social worker strengthen your advocacy? This question for me, lots of other fields do a better job of just patting themselves on the back and celebrating why they're uniquely skilled, talented, the perfect position to do it. The answer to number 3 is, for me, being a social worker means understanding that context and structural pieces impact our each individual's ability to be healthy, productive members of society. So we think about context, we think about race, we think about class and income, we think about discrimination, we think about structural barriers, we think about systems that make it hard for vulnerable populations to succeed, along with everybody else who enjoy other advantages, right? So being a social worker strengthens my advocacy because my training is to understand individual and human needs and also systems and structures that impact those, the ability to meet those needs. And not every field does this. I do think it's becoming more and more important for our sister fields in public health and so on. But this is social work's roots, and it's just so aligned. Advocacy and social work are so aligned and embedded that even if you're in direct practice, there's no way that you aren't facing or addressing in some way the structural barriers that keep your clients and patients from being able to succeed. Number 4, why is it important for social workers to be aware of and engaged in the community and macro level issues? Because, gosh, for me, the answer to this is so obvious. Because we are mission driven, because we understand poverty and how it impacts mental health and community well-being, how poverty impacts families, how poverty impacts every thread of life, and because we do the work. Because if you're a social worker, no matter what you're doing, you have a deeper, more nuanced, evidence-based understanding of social problems that position you uniquely to understand what changes need to be made in order for our communities to achieve health and well-being. So I know that sounds really generic. I'm going to try and go back through 1 through 4 and just see if I can give some specific examples before signing off. So what kind of work advocacy I'm engaged in? So I talked about the charity program. There's another set of activities and projects that I'm a part of. One includes something you may be interested in Googling also, which is called Mary Harvin Apartments. It's a low-income senior building in East Baltimore that was in the news after Freddie Gray died because the building was burned down right before it was scheduled to be completed, and rebuilt very quickly. It's now home to about 63 seniors in the community, and Johns Hopkins has gotten out of its hospital walls to lease a space in the building and do community health improvement. And there's a variety of programs that we've implemented, but a lot of it is just relationship building and establishing trust. And there's a steering committee, like many of these kinds of interventions, made up of lawyers, physicians, finance people, all thinking about strategy and alignment with other institutional goals. I'm a part of the steering committee, and I get to be a part of those conversations and pieces, and I also get to bring the social work perspective of individuals, communities, families, poverty, social systems. And so together we think about how do we bring our resources together to listen to the community, address what we can, the things we're good at least, and move forward in a way that is distinct for a hospital. And so Mary Harvin, the charity program, did I give you the name? It's called TAP, the Access Partnership. There are a variety of different skills you need to have any kind of job. One is just awareness, self-awareness, knowing your community, knowing your client, knowing the issues, and having the confidence to be at the table to think of yourself as a key player. Is any of that helpful? I realize doing this, there's a reason I'm not a radio host or Oprah. I would be happy to answer any follow-up questions if you have any. You can reach me at AOV as in Victor, ERD as in David, 01 at jhmi.edu. And thanks so much. Good luck to all of you. Bye-bye.